In order to stay on schedule, we're going to begin. So I'm gaveling us back into session. Amanda, do you have any, Dr. Cohn, do you have anything to say, or should I proceed with the public comment?
Jose, this is Jessica. You can go ahead and proceed.
Thank you, Jessica. All right, we will proceed to the public comment. So I'd like to say at the onset, I'd like to welcome and thank the public comment speakers for addressing the ACIP today. All speakers today submitted a request in advance of the meeting, and a final list of public commenters was determined by a lottery. For the speakers, please, we have a limited period of time for public comment. In order to make it through the session on time and all the listed speakers, it's very important that each speaker limit his or her remarks to 3 minutes. I will be very strict on this. If you exceed this, you will be terminated at 3 minutes and 15 seconds. We are displaying a timer on the screen so you'll know how much time is left. Again, we thank the speakers for their comments. These are very important to the ACIP voting members to know how the public feels. Please begin. So we will start with Mr. Daniel Pyrin. Please state your affiliation, your organization, if you will. Mr. Pyrin, the floor is yours.
Okay, thank you. My name is Daniel Pyrin. I don't know if I got a relevant, thing. I'm here. I work with a company called Aviana, but that's not really relevant. I'm speaking on my own behalf. And as a nurse, I'm aware of the importance of public health and disease prevention. So I want to thank you all for the time and effort you put into the ACIP. And I also want to say that there are many who support your work despite the noise and the threats from a few. The benefits of vaccines ought to be very obvious as they reduce suffering, save lives, and reduce healthcare expenditures. Yet, we are failing to properly educate parts of the population, allowing fear and misinformation to spread and threaten public health. Exactly how we need to improve our social media presence and conventional media presence, I am not sure. But we need to do a better job of getting the message out to those who are on the fence about vaccination. It seems a variety of styles and measures are needed to push back against the misinformation, and this is going to be a long, slow process. Even though the COVID pandemic serves as a reminder of the dangers of unchecked infectious disease. I want to thank you for giving me this time, and I'm looking forward to the session on COVID-19. Thank you much.
Thank you very much for those comments. We'll move to our next speaker, Ms. Elizabeth Sobiks. Excuse me for not pronouncing your name correctly. Please introduce yourself and the correct pronunciation of your name.
Subcheck.
Thank you.
Thank you for the opportunity to provide comment today. I'm Elizabeth Subcheck, Director of Strategic Alliances for the Gerontological Society of America. GSA honors aging across the lifespan and is the oldest and largest multidisciplinary organization devoted to research, education, and practice in the field of aging. GSA hosts the National Adult Vaccination Program with the purpose of affecting policy and improving adult immunization rates. We routinely bring together stakeholders to make recommendations that address the specific needs of older adults on topics such as influenza vaccination, raising vaccination rates in long-term care facilities, and understanding shared clinical decision-making best practices. Despite the health benefits that result from implementation of ACIP recommendations, vaccines have been consistently underutilized in the adult population. This year, public awareness of the importance of vaccines is heightened as it relates to COVID-19. As influenza season is approaching and education campaigns are advanced, we respectfully request that the CDC communications underscore the importance of older adults receiving all ACIP recommended vaccines. Likewise, we respectfully request that there is an increased emphasis on the importance of vaccinations for people who care for older adults in close care settings, especially nursing homes, assisted living, and home care. Additionally, we request that specific consideration be given to the unique immunologic challenges that older adults present. Immune responses to influenza vaccines decline with age, reducing clinical effectiveness. We know of the evidence that certain vaccines work better for older adults. Finally, we ask for considerations for guidance that makes all adults feel safe in receiving vaccinations in their chosen location this year and moving forward. Providing these communications through healthcare providers in the aging network will give older adults and their caregivers the confidence to receive their recommended vaccinations. GSA recently published a fact sheet entitled Aging and Immunity: Why Older Adults Are Highly Susceptible to Diseases Like COVID-19. This fact sheet highlights the process for developing a COVID-19 vaccine and discusses changes in our bodies as we age that impact immunity. All the more reason to ensure older adults receive all ACIP recommended vaccines. GSA supports ACIP and the CDC's efforts to increase vaccination rates in all adults, and in particular older adults and those who provide care for them. We are pleased to support your efforts and to work with advocates to amplify these messages through the Aging Network in order to raise awareness, improve access, and increase utilization of vaccines for adults. Thank you for your dedication and service to this committee and to the public whom you serve.
Thank you for your comments. Our next speaker, please, is Ms. Amy Pisani. Please identify yourself and your organization.
My name is Amy Pisani, and I am the Executive Director of Vaccinate Your Family. Our organization seeks to protect people of all ages from vaccine-preventable diseases. For nearly 3 decades, our organization, along with our partners in public health, have developed many successful strategies to ensure that every individual has access to life-saving vaccines. Vaccines are one of the most important tools we have to keep families and communities protected against highly contagious diseases. We at Vaccinate Your Family want to make certain that parents and individuals continue to feel confident that vaccines given to protect lives remain both safe and effective. After a vaccine is licensed and recommended for use in the U.S., there are 4 systems in place that work together to help scientists monitor the safety of vaccines and identify any rare side effects that may not be found in clinical trials. We remain highly confident in the robust vaccine safety systems in place here in the U.S., including the Vaccine Safety Data Link, Vaccine Adverse Event Reporting System, the Post-Licensure Rapid Immunization Safety Monitoring System, and the Clinical Immunization Safety Assessment Project, all of which are described on our website. Vaccinate Your Family has a policy in place expressly supporting the recommendations of the ACIP and the immunization schedules voted on by this well-informed body of independent experts. ACIP's recommendations are the foundation upon which our nation's successful vaccine program is based. In order for the public to have confidence in the safety and effectiveness of future COVID vaccines, it will be critical that decisions be driven by science, and the decision-making process must be transparent. To that end, we urge that the ACIP and VRBPAC be involved in evaluations of the data of vaccine candidates and deciding whether and how these vaccines should be available to the public. ACIP sets the standard of care for vaccines, and providers rely on the committee to set the parameters for clinical care. Insurance coverage is based on the recommendations as well as VFC coverage. It is therefore imperative that any COVID vaccine recommendations for our nation are set forth by the ACIP, who can offer detailed recommendations for each population. Only this committee has the history and expertise and the trust of the healthcare community and the public. We remain confident that this committee will take action to monitor safety data on current and future vaccines, including those to prevent COVID-19, to ensure their safety as soon as they begin to be put to use. In closing, the COVID-19 pandemic has shown us what those in public health have suspected for many years. Chronic underfunding and neglect of our public health infrastructure has left us vulnerable to infectious diseases. Unfortunately, vaccines are only effective if people receive them. Yesterday, Vaccinate Your Family released a special State of the Immune report on the issue of COVID vaccination preparedness. In this brief report, we examine the 5 steps Congress must take to strengthen our country's vaccine infrastructure and ways to help constituents understand the value of vaccines. We urge members of the public and this committee to read our report by visiting our website, www.vaccinateyourfamily.org. Thank you so much for your time, and thank you for what you do every day.
Thank you for those comments. Our next speaker is Ms. Michelle Cantu. Please identify yourself and your organization.
Hi, my name is Michelle Cantu. Can you hear me?
Yes.
Yes, we can. Thank you.
Hi, thank you to the Advisory Committee on Immunization Practices for your commitment to providing evidence-based recommendations, your vote today, and for the presentations. Absolutely, thank you. Thank you for the presentations on COVID-19 vaccination this afternoon. My name is Michelle Cantu, and I'm the Director of Infectious Disease and Immunization at the National Association of County and City Health Officials, or NACHO. Our mission is to improve the health of communities by strengthening and advocating for the nation's nearly 3,000 local health departments. We know that nearly 90% of local health departments provide direct immunization services to both adults and children. Further, they conduct essential immunization activities such as surveillance, providing education, and developing communication campaigns. As the world and nation face this historic pandemic, it is important to highlight that local health departments have been and continue to be on the front lines supporting their communities. In a recent assessment, NACHO explored the impact of COVID-19 on local immunization programs. Results indicated 88% of local immunization program staff were reassigned to respond to COVID-19. Nearly 90% indicated that essential immunization program services have been impacted, and 62% reported a noticeable decline in vaccination coverage rates. Alarmingly, state and local public health officials have reported an increase in job losses, resignations, and threats from the public as they recommend public health guidance to mitigate the threat of COVID-19 in their communities. Regardless, public health remains committed and dedicated to address vaccine coverage, prioritizing health equity, promoting vaccine confidence, and preparing for the upcoming flu season. During this unprecedented time and in preparation for a COVID-19 vaccine, local health departments are being called upon to review vaccination protocols and explore strategies to reach vulnerable populations. In addition, we are focused on vaccine confidence, which is critical to assuring that vaccines are widely accepted. NACHO commends the ACIP for your quick assembly of an ACIP COVID work group. As the ACIP continues to factor evidence-based recommendations for COVID-19 vaccination and weigh vaccine prioritization, NACHO encourages the continued consideration of these implications as public health and partners prepare to implement them and ensure confidence among the communities they serve. To ensure the successful deployment of vaccine and acceptance among the population, the field turns to the ACIP for clear guidance, defined priority populations, strong recommendations that assure safety and efficacy of the COVID-19 vaccine, and support for the established coordinated vaccine delivery systems. Thank you for this time and for your dedication to this work and these continued considerations.
Qualm? Ms. Qualm?
I'm sorry about that.
We can hear you now.
Okay. Thank you. I'm a healthcare professional with a master's degree in the science of nurse anesthesiology and a mother of four. 4 years ago yesterday, on June 23rd, 2016, I took my healthy, vibrant one-year-old twins to their one-year pediatrician appointment. At that appointment, they received a clean bill of health, as well as PCV13, TB, Hep A, and MMRV immunization. What we did not receive that day was informed consent. Informed consent would have included that MMRV carries double the risk of febrile seizures as MMR and V given separately. This would have been useful information as my son had a history of febrile seizure. I believe that this was recommended in the sake of compliance because I had asked that day for the first time since becoming a parent to split or delay some of those shots. Nora died 7 days later, in the night of June 30th into July 1st, of what experts now believe was a terminal febrile seizure. The known peak of febrile seizures after measles-containing vaccinations is day 7 to 10. Her fraternal twin sister, Lucy, continued with a fever day 8 post-vaccination to day 15 post-vaccination, which was the day of Nora's funeral. ACIP already recommends that ProQuad not be given to kids under age 2 unless at request of a parent. I have now met other parents whose children had their first febrile seizures post-MMRV, later dying officially of indeterminate causes. Febrile seizures are typically thought to be innocuous and that children grow out of them. However, published in JAMA April 2019, a study published found that almost 30% of deceased children of unexplained causes had a history of febrile seizure, compared with 3% of the general population. In Pediatrics, July 2010, they concluded that there was an additional one febrile seizure for every 2,300 MMRV vaccinations given. That additional febrile seizure was my daughter, Nora, and it ended her life. What I am asking for today is my understanding is that this committee approves the recommended schedule in October. What I'm asking for today is that a work group be made to reevaluate MMRV's use in kids under age 2. Once your family or child is a statistic, the numbers are no longer comforting. It has been 1,454 days since my daughter died. Please consider removing ProQuad for kids under age 2. The risk of febrile seizure is known to be double. Thank you for the opportunity to speak to you today.
Thank you for your comments. Our next speaker is Ms. Elizabeth Ann Seitz. Please state your name and your affiliation.
Ms. Ditz, I don't know what phone number you're calling from, so I cannot unmute you. Could you please email me? Yeah,
and go on to
you
the
want to do
next one.
Blanc Otto? Huh?
Yeah. Let's move to Mr. Blanc Otto, and then we will come back to the previous speaker.
Mr. Blanc Otto?
470.
Please state your name and affiliation.
Dr. Romero, pleased to make my third testimony to ACIP. My name is Bob Blanc Otto, and on behalf of the National Association of Nutrition and Aging Services Programs and the 4 million older adults that we serve every day, I'm here to make a specific request of the committee. My request is to suspend until the end of the pandemic your June 2019 recommendation for shared clinical decision-making between patient and provider in deciding whether to get the PCV13 pneumococcal vaccine. I make this recommendation for the following reasons. The first is a new reality caused by the pandemic with fewer older adults visiting any healthcare provider where their shared clinical decision-making discussion would take place. The second real concern and consequence in maintaining shared clinical decision-making is that fewer older adults will be vaccinated against pneumonia at a time when we should be striving for greater vaccination rates. As we have noted previously, there is approximately a 66.9% overall pneumococcal vaccination rate for older adults. For African American and Hispanic older adults, the rate for PCV13 vaccinations is a full 10% and 15% lower than for white older adults, respectively. This pandemic has exposed the degree to which health disparities has contributed to the disproportionate rate in that older minority adults have contracted COVID-19. We cannot maintain policies that by their nature exacerbate disparities. Finally, we note that in the guidelines for shared decision-making, they fail to address the very real issue raised in a Health Affairs article, which noted that in a survey of over 650 family physicians, only 24% were able to correctly identify the definition of a clinical decision-making recommendation. In this time of great uncertainty for older adults, we certainly do not need any more confusion about an important issue such as being vaccinated. We urge you to add this recommendation to suspend to your agenda today or schedule it for sometime in the very near future so it can be communicated to CDC. We are only a few months away from what is expected to be an active flu and pneumonia season. We need to do all we can to protect older adults from either, and certainly from COVID-19. I also repeat our support for an earlier recommendation that ACIP add at least one member with expertise in geriatrics to better inform the work of the committee on issues of special significance to older adults. That expertise would have been beneficial during the June 2019 PCV13 vote, and it would still carry important significance today. Thank you very much.
Thank you for your comments. Let's return to Miss Elizabeth Ann Seitz, please. Please identify yourself and your affiliation.
Good morning. Greetings, esteemed members of the committee and persons listening online. Thank you for giving me the opportunity to speak. My name is Liz Dietz. I'm speaking with you from my home in San Mateo County, California. Although I support and am involved with a number of public health advocacy organizations such as Voices for Vaccines, Vaccinate Your Family, and Vaccinate California, today I'm speaking only for myself. I have just one point today. I have been observing the grassroots opposition to immunization for over 2 decades. This opposition is extremely well funded. Unlike the pro-public health, pro-science, pro-vaccination organizations such as those I mentioned previously, Voices for Vaccines, Vaccinate Your Family, and state-level organizations such as Vaccinate California. In my opinion, the opposition to routine vaccination is an enormous threat to public health in ordinary times. In these extraordinary times, it's even more threatening. My ask is simple. Could there be an ACIP working group on advancing immunization acceptance? Increasing confidence in the safety and efficacy of immunization across the lifespan is always critical, but in this setting, paramount. Having a working group to understand the opposition to immunization would do a great deal to advance the acceptance of immunization. Thank you all, two members of the committee. This concludes my comment.
Thank you for those comments. Stephanie, is there anybody else that might have called in late to make their comment?
I don't see anybody else. We have 2 people in the waiting room, but I'm not sure who they are.
So I think that ends our public comment session. And we'll proceed to the votes now, if that's acceptable. Dr. Cohn?
Yes, please give us just a minute. We're going to pull up the 2 votes that are on the table for this morning. The first one is the meningococcal vaccines for children resolution.
So while you're pulling that up, I will explain the voting today. So the roster for voting was generated by a random generator in the order of for the order of the votes. I will call your name, voting member, and ask you to please vote. I will vote at the end, and then we'll ask if there are any comments that you have before we move on to the next vote. So while you're pulling that up, I will explain the voting today. So the roster for voting was generated by a random generator in the order of for the order of the votes. I will call your name, voting member, and ask you to please vote. I will vote at the end, and then we'll ask if there are any comments that you have before we move on to the next vote.
So the first vote that has been motioned and seconded is to accept the VFC resolution vote to accept changes to the VFC resolution for meningococcal vaccines.
Very good. Are there any comments or questions from the voting members before I call the vote? Very good. Beginning. Dr. Atmar.
Atmar, yes.
Dr. Szilagyi.
Szilagyi, yes.
Dr. Bernstein.
Hank Bernstein, yes.
Dr. Talbot.
Kip Talbot, yes.
Dr. Fry.
Fry, yes.
Dr. Bata.
Lynn Bata, yes.
Dr. Paling.
Let's come back to Dr. Paling while we try to get her off of mute.
Thank you. Dr. Alt.
Kevin Alt, yes.
Dr. Hunter.
Hunter, yes.
Ms. McNally.
McNally, yes.
Dr. Sanchez.
Sanchez, yes.
Dr. Bell.
Bell, yes.
Dr. Cohn, do we have Dr. Paling on the line?
Can you hear me this time?
Yes, I can.
Paling, yes.
And Jose?
Dr. Lee?
Oh, thank you. Grace Lee.
No, I had not forgotten about you. Sorry.
Grace Lee, yes.
Thank you. Romero, yes. Dr. Cohn, would you give us the tally?
So the motion passes with 14 yeses and 0 noes. I just want to remind everybody before the next vote to please also state if you have any conflicts of interest. None were stated at the beginning of the meeting, but please restate before you do the vote for the second vote. So thank you all. We can move on. We can move on to the second vote for influenza. This vote has been, a motion has been made for this vote and has been seconded to accept the changes to the ACIP influenza statement for the 20 to 21 season.
Are there any comments or questions regarding this issue from the voting members? And I will proceed to call the vote. Dr. Paling.
Kathy Paling, no conflicts, yes.
Dr. Atmar.
Atmar, no conflicts, yes.
Dr. Szilagyi.
Szilagyi, no conflicts, yes.
Ms. McNally.
McNally, no conflicts, yes.
Dr. Bata.
Lynn Bata, no conflicts, yes.
Dr. Fry.
Fry, no conflicts, yes.
Dr. Hunter.
Hunter, no conflicts, yes.
Dr. Lee.
Grace Lee, no conflicts, yes.
Dr. Talbot.
Talbot, no conflicts, yes.
Dr. Alt.
Alt, no conflicts, yes.
Dr. Sanchez.
Sanchez, no conflict, yes.
Dr. Bell.
Bell, no conflicts, yes.
Dr. Bernstein.
Hank Bernstein, no conflicts, yes.
Jose Romero, no conflicts, yes. Dr. Cohn, the tally and the verdict?
Great, so the motion is accepted unanimously, 14 yeses. So the motion passes.
Very good. Are there any comments that the voting members wish to make at this time? Okay.